Ontario has joined Alberta in pausing the use of AstraZeneca vaccines for first doses. Cases of blood clots after use of AstraZeneca have increased slightly, from 1 in 100,000 to 1 in 60,000, still extremely rare. But it's one factor in Ontario's decision to limit AstraZeneca to second doses.
This decision was made out of an abundance of caution due to an observed increase in the rare blood clotting condition known as vaccine-induced immune thrombotic thrombocytopenia.
Alberta was the first to stop using AstraZeneca for first doses. It's not about higher risk for AstraZeneca, says this specialist.
The supply has dwindled of AstraZeneca, and so they are no longer able to provide enough vaccines to give everybody the second dose.
If there's enough Pfizer and Moderna vaccine to replace the AstraZeneca, then I think that is a reasonable thing to do.
Up to now, more than 2 million doses of AstraZeneca have been distributed across Canada, but it represents less than 13% of the total. Moderna accounts for 22% and Pfizer over 64% of total vaccines distributed. But AstraZeneca's share will shrink further. Ottawa is expecting 1 to 2 million doses of AstraZeneca by the end of June, but more than 18 million doses are coming from Pfizer. The Pfizer share is sure to increase. Use of AstraZeneca will decrease to below 10%. Officials in Ottawa still recommend AstraZeneca for first dose and second.
So we will make sure that those who got the AstraZeneca vaccine, the first dose, can be provided with a second dose. At the same time, we're following the evolving science.
The evolving science, however, includes a UK study expected late tomorrow that may advise that a second dose doesn't have to be the same vaccine as the first dose, which may tilt toward even greater use of Pfizer and Moderna.
What I do have concerns with is, the ongoing discussion, what dose number 2 looks like for those of us who got AstraZeneca.
Public health officials say AstraZeneca remains a safe vaccine, period. But it looks like it will be used less going forward. Eric Sorensen, Global News, Toronto.